Thank you. I'm Robert Dempsey, and this is the neurosurgery update on the COVID-19 crisis. We're in the middle of this crisis at this time. We're recording this short update so that the nurses and other staff that may wish to go over this later will be able to. I say that we're in the middle of this crisis because that's my estimate. It's a guess, but it's a guess based on looking at the facts and figures. And therefore, it's a time of both fatigue and resilience for everyone. So if there's anything that I really want to be as a take-home message of this, is to stop, take a deep breath, and thank somebody. And if you're in the hospital, I mean, thank the cleaning crew, thank the people that are pushing the beds, thank the people that kept the doors open, because the surgeons are less important than those people. Thank the nurses, obviously. If you're not in the hospital, turn and thank your families, your friends, because their careful following of the rules have kept you healthy and safe. And that's really unique. This has been a unique crisis. We've all been through crises in our life, some rather dramatic, some less so. But this one will be defining for a lot of our lives as to what happened, because we did it where we felt we were alone. This social isolation or physical isolation has been difficult, and it's caused a great disruption in what we thought was our normal life. And Dempsey's rule is that change is often good, but it's always hard. And this has been hard. However, much is coming from it. We're learning a lot about ourselves. Let's see where we are and where we need to be and what the future holds as best we can tell. This has been a major pandemic. It is not to be underestimated. I talked about some of the other ones which affected 1 million people. This is really at the 5 million person mark so far. And we know that this is an underestimate. In some countries, they only really check to see if you have autopsy proven COVID, when we can tell by the increased numbers of deaths worldwide that we probably underestimate most pandemics by a quarter or a half. There have been over 320,000 deaths recorded. The United States represents about a third of that, to 25% to a third of that. Wisconsin has been relatively spared, and Dane County very much so, 541 cases, 25 deaths. The reasons are many. They have to do with luck, massing of people, communication, following the social rules, but a lot of it is luck, and that's to be understood. What's happening here in UW is kind of a microcosm of a lot of the United States. We have been able to weather the storm. We have been able to protect people here, and we've understood that the effects of complete isolation, completely shutting down society, are untenable. We need to produce food, we need to check up on people, we need to do essential services, and we found out the definition of essential is a little broader than just healthcare. However, as we look at that, even within UW, different things have taken different emphasis. Presently, we have opened up the operating rooms to about 70% of its normal for this time of year. Inpatients, about 80%, and clinics, surprisingly enough, about 90%. Now, how did we do that? Well, we did it mostly with televisits. We did 1,300 tele or video or electronic visits of patients a day in the last week. And that's very different. It's going to change the way we practice medicine forever, just as the lessons learned from society will change society forever, hopefully for the better. What does this mean? Well, it means that we've also at risk of, because of the fatigue, becoming overconfident or thinking that we're normal. We're far from it. If you look worldwide, the distribution of cases is consistent. It's not rising worldwide, but it is consistent. and it's woefully underreported as it now is beginning to spread through the equator. And that's a region that is really troubled. As you get to Ecuador, Brazil, Bangladesh, we're beginning to see outbreaks that are not being reported. We know by talking to our physician friends in those parts of the world that their hospitals are overwhelmed by these mysterious uptick in deaths, many of them respiratory, but not all. And there's an important lesson. Bangladesh and the refugee camps between Myanmar and there are already some of the most troubled places in the world, medically, physically, health-wise. They're facing now the first cases of COVID there and one of the largest typhoons or cyclones in the history of that region. So we are very fortunate, and what I've said all along is I'm not as worried about ourselves as I am about everyone else and their effects. And the effects here, we're beginning to see, even though Wisconsin has been protected, an increase in certain nursing homes in Belmont, in Beaver Dam, in other small towns across the state. This compiled with the children who are showing this bizarre vasculopathy. And we're beginning to understand the scientists are telling us much more about that, which will be important when we start to think about how long will this disease go on and what might its impacts be. Viruses, as I said in my first lecture, can be specialized for certain cells, but can see receptors in many parts of the human body and even some other species. We know it affects brain, we know it affects blood vessels, but this one appears to have, in some people, we don't know why, a massive immune response. Now, the immune response is how you overcome the virus. It's how a vaccine works. But in some people, in a delayed fashion, this can cause the blue toes, the renal failure, the multi-system failure, the cardiac events, the strokes. And those people will not test positive by the respiratory testing that we do. They'll only be positive when we look at antibodies. So this is going to be important when we think about vaccines. We have had an instance of vaccines for Hong Kong flu in the past, turning out to have delayed side effects on other organs, causing it to be a failure. Therefore, this is going to be a precautionary tale. We do know that the world impact is major on economy. Unemployment rates are unsustainable, and the response of any major economic downturn is generally to try to decrease expenses, increase revenue. Well, we've not been doing that because what we've been doing is simply trying to pay unemployment as opposed to trying to figure out how do we safely reopen. So there's a push toward reopening which might be unsafe. The lessons learned at this hospital and others suggest we can do this, we can work, we need masking, we need isolation, we need testing to see where it's safe, and when we see cases, we need contact testing and isolation. That works. It worked well in Korea. It needs to work here for us to really get the economics back on track. I can be more specific about UW because most of us work here, and that's rather important. We know that in order to try to balance the books in an industry like the health industry, which was doing very well in February, and then was cut in half or lower, that the losses are unsustainable rather quickly. Nevertheless, if you look at the unique way that UW works and we're able to open the ORs and sustain them, we could work our way out of the immediate problem over the course of 4 to 6 months. Meaning that if we can survive the short term, open carefully, we can provide our care and not have to close the doors. And that's really the race every industry is in right now. But some of them are more sensible than others, and that's a problem. Because if you suddenly open everything as if it were a meatpacking industry and you get these massive numbers of people sick, it will overwhelm the health system, will be worse than back at square zero. The logic of that is really what we did to try to decrease this COVID crisis. Lacking a vaccine, lacking a treatment, we used the idea of social isolation. That cuts 2/3 of the deaths out, and that's a huge number. And that really is happening, certainly in Wisconsin, if not in other parts of the world. But it extends the curve by about twice as long. So if you look at what happened in Wuhan and extrapolate that to here, we're talking to into the summer of having to maintain this as a minimum. If indeed the virus is kind enough to mutate to become less virulent, it would die out. We cannot expect that. We said last week that it's not really mutating very rapidly. And what that means is that we have been very healthy in this state and now are cautiously trying to get lives a little bit back in order. But we cannot do that without realizing that none of us are immune to this virus. And when we look at antibody levels in Dane County from people that were just curious about getting tested, they're about 2%. That's about the error rate of the antibody test. So it's very low. What does that mean? It means two things. The antibodies studies are presently helping two major areas. One, the epidemiologists to try to figure out when it's safe. And two, the people trying to treat the unusual strokes, heart attacks, etc., because this may be late COVID symptoms without respiratory. It does mean we have to consider the possibility of life with the virus without a vaccine. One of the reasons vaccines may fail is that they cannot recognize something unique about the virus, or it keeps changing too much. Well, if this one stays pretty constant, that's not the concern. But if this virus causes in a fraction of people a huge immunologic response, we have to be as careful as possible not to have the vaccine cause that. So rushing the vaccine, pushing it as early as we had hoped, may be unwise. And therefore, we have to think very seriously about what do you do to live with this? Life has changed and will change forever. Go back to the first talk I gave. I said we had three major jobs. One was we had to protect our patients. Our base job is taking care of people with brain tumor, stroke, pain, congenital anomalies. These are very important things. And they really affect more people than COVID. So therefore, that's our base job. We do that, we do it very well. I'm immensely proud of everyone. The second thing is protect our team, our entire team, our office staff, our social workers, our residents, our nurses, our trainees, everyone. And that means we've been very good at that, but we have to protect them in every way, including to really affirm the essential importance of what they do. We need the students back. They need to be learning how you handle yourself in a crisis, how you handle infectious disease. I'm glad to say that's going to be happening in phases each month, June, July, August. We need finally to repurpose, to change, to rethink the way we do things. And therefore, you take some time in the middle, if it is going to be for the long haul, to stop and say, what are we going to be doing? How do you handle fatigue? How do you understand the resilience of the human spirit? How do you encourage people to see their doctors? Because that's our base job. And so it suddenly becomes important to say, okay, we can do this. It is not the end. It's actually, the sun's going to rise again, and we're going to take care of it. So stay healthy, pace yourselves, but look after others. I don't care if that's your neighbors, your family. You can do it with all these phenomenal new things we've learned about, about Zoom conferences, about talking to family. Lord, we don't need any more Zoom conferences, but we do need to talk to our families in that way, to talk to our friends, to reconnect with people. And what we learned is that telehealth is going to be an essential part of medicine going forward. And it will save money, time, convenience for the patients, which are far more important than for the doctors. We learned that your life can change in a moment. I mean, in February, we had no clue of this. This was something far away. We learned that everything is connected, that the people that I've seen in Africa or I've seen in Bolivia, they're at risk right now. And we better hope that the steps we did to help them will help tide them through, the systems we helped put in place. That's the same right now in our society and in our department, is that camaraderie and teamwork that I'm seeing, that I'm so proud of, that will get us through. We will gradually and sequentially begin to open things up. If we can keep the local population healthy, we'll be able to get back on step, first taking care of sick patients, then taking care of well patient cares as a medical system, then taking care of research, then taking care of the staff work to allow this to continue and to improve. I think that what we really did is we learned that when life changes in a moment, my African friends have a saying that when man makes plans, the gods are laughing. And so we learned what was important. It was family, it was teamwork, it was being fearless about saying, yeah, we can do this. We'll get the right protection, absolutely, and we'll take care of sick people. We understood why we chose this field of medicine and why everybody supports it and why the person who cleans the rooms is in the field of medicine, the person who does the staff work, who makes it possible to keep the doors open, they're in the field of medicine, and we're proud of it. We learned that we really didn't need all of the distractions and purchases that we used to do. We're learning what's important. And we probably better pay attention to that when we think about what are the job opportunities, et cetera, for our children, for our colleagues, for ourselves. We learned much about ourselves, but I think we'll all be better for it. So my lesson today is one of hope. We are indeed, at least internationally, appearing to be past the top of the curve. We did that by reducing the number of exposures, and therefore this decline to safety will be long. I don't know how or when it will end, but at this rate, it may be improved by the fall, not have over. I don't think the vaccine is going to be as quick as I thought because of the immune reactivity we've seen, but that will mean they'll have to do it carefully. And we will continue to care for each other by being alert to this situation long into the future. As always, I'm proud of everything you do. I'd be glad to take any questions you might have.